I think the issue of cost is always first and foremost in every patient's mind. It comes down at the end of the day, put it this way, telling a patient that they can't have robotic surgery and they have to have an older form of surgery is like telling your child you cannot have a smartphone, you have to use an old Nokia phone that still uses 1G or 2G, a 2G network. Right? So we understand that the cost of technology over time will decrease significantly. And now more than ever in the evolution of robotic surgery, we are going to see the cost of robotic surgery drop drastically. Why? Because obviously there's market competition. So that's one factor. The other factor, of course, is how the robotic surgery is financed or charged by the hospital institution. So one of the things that we'll be discussing at this meeting is how to change the mindset of a hospital administrator in terms of how they charge for the robotic surgical service. So a key part of the robotic surgical service has always been that it's a premium service. So a premium is charged by the hospital to use it. But once the hospital realizes that this is actually not a premium service, but actually an efficiency tool to provide surgical service more efficiently, so patients don't have to wait as long to get their surgery, because you can do more surgeries in a day than traditional forms of surgery. And then it's an assistive technology that the hospital is using. Then, in terms of billing, in terms of costs, it becomes more rational. So we've published data as well over our 10-year experience, where the hospital bill size of open surgery, as Dr. Ruma pointed out, was the standard of care when we started our program and we converted to robotic. The hospital bill size for a robotic surgery actually ends up being lower than that of an open surgery because of...
I think it takes time for the patient to recover. Patient is in the hospital for a much longer time. If I give you an example of the gynecological cancers, say uterine cancer, these surgeries are more expensive. So as you know, the incision also is much more extensive. Most of the time these patients start orally on day 2 or day 3, and we are able to discharge them around say day 5, 6 or maybe 7. IV fluids, antibiotics, looking at the recovery of the patient, I think patient starts moving on maybe day 2 of the surgery. So when you look at the overall cost, this I'm sharing my experience with you, and look at the cost of the robotic surgery. In robot-assisted surgery, in our experience of doing it in uterine cancers, exactly the same I think I'm giving you the example. They are taking breakfast the very next day morning and they are going home in the evening. Long incision complications are not there only. I remember the days because over the period of last 28, they have hypertension. And we used to do a lot of dress, the incision healed. But all these things have gone away. In last 8 years, those who are having a lot of morbidities, and you feel so confident, definitely the robotics actually supersedes. I think, I don't think so that robotics...
And my colleague just saying, it's an instrument, So we've been doing keyhole surgery for a while. The first laparoscopic hysterectomy was done in 1989. Yet it depends where you live, and even within the same country, which area you live, you could still have open procedure. Why? There were challenges, with keyhole surgery, ergonomy, and this is where the robotic platform, all it is a laparoscope, but from the surgeon point of view, you're ergonomically well seated, because we know from the evidence, the longer the procedure, the more tired the surgeon. This is where you start making mistakes, So if you're sitting comfortably, and I'm not saying the robot just to benefit to the surgeon to sit, but more complex, long procedures, you'll do less mistakes. The robot is nothing different than another instrument. The surgeon has to be trained, like your colleague saying there very rightly so. It is an instrument, but it's a massive instrument. So if you don't use it well, you could do harm more than a small instrument, So you have to learn about how to use your instrument, and you need to learn how to troubleshoot if problems occurs, and sometimes they do. Like Ruma said, it's a machine, you go buy a toaster, and sometimes it doesn't work, hair dryer doesn't work, but you learn robotic surgery is very safe. It's more safer than standard laparoscopy. Why? Because things do happen, not necessarily from the machine, but from your assistant. So if I'm doing an operation, complex operation, my assistant holding the camera, but he or she fainted, they'll take the instrument with them. If they're holding on to something, they'll pull it with them. If I'm operating and I have a massive heart attack, and I'm holding to something, will tear the patient. With the robotic platform, doesn't. So you sit in certainly in one of the robotic platforms, you know, there's lots of, and we talk about cost in a minute. You sit in, you have to put your eyes in a visor, you're deep into the patient, as if you're inside the patient's abdomen. The moment you take your eyes off the visor, everything stops in the patient. And this is very safe. Now, that means if I had a heart attack sitting on the console, the patient, no harm will happen to them. Does it make sense? Now, you might say,
patients who have higher incidence of polycystic ovaries, high estrogen, so more amount of fibroids and endometriosis. So, all these three fields, whether it's fibroids, endometriosis or cancers, robot-assisted surgery actually gives a better outcome to the patient.
As far as cancer surgery concerned, there was always a concern whether you are doing the same quality of surgery by using minimal invasive technique, be it laparoscopy or be it robotic surgery. I think there have been a lot of studies that have dispelled this, that okay, minimal access surgery is as safe as open surgery. So cancer surgery, whether you do open or whether you do keyhole surgery, the outcomes are the same, barring few cancers.
That in laparoscopy, it takes less time to produce a good robotic surgeon than a laparoscopic surgeon. A laparoscopy training, to master a surgery in laparoscopy takes many more years of time than to do it in robotic, because of the ease of operating and also the way it mimics open surgery. That's why it is much easier to learn. So even some people say that you can move from open surgery to directly to robotic surgery without going through laparoscopic surgery. So when we had this plan of this program which you see on the screen, we had the issue in hand that what you asked. What about training? You have the technology, you have the surgeons, who will train them? The major problem of training in India, or rather I will say worldwide, was access to training. There are many surgeons who are very eager to learn new things, but they don't have the access to training, because the system that is persisting in most part of the world is that you get to train when your hospital has a robot. And your hospital administration decides who are the surgeons who are going to go for training. There will be maybe 50 surgeons in a hospital. All will not get the chance to get on the robot, but all of them may have the wish to do so. And that is where we thought that there is a role as a society to give it back, just like Madam said. And we thought that we should take advice and guidance from a society who is already doing it for a few years earlier. So we joined hand with the European Society.
To help women of this country. So the association వాళ్ళకి ఒకటి robotic surgery కొత్త టెక్నాలజీ, అది టెక్నాలజీ ఒకటి టూల్. రోబోట్ ఏం లేవు సర్జరీ కోసము, సర్జనే సర్జరీ చేస్తున్నారు. అది సర్జన్ రోబోటిక్ టెక్నాలజీ గురించి చాలా ప్రిసైజ్ సర్జరీ, చాలా బెటర్ సర్జరీ, బెటర్ అవుట్కమ్, లెస్ బ్లడ్ లాస్, పేషెంట్కి చాలా తక్కువ నొప్పి, తొందరగా రికవరీ అయిపోతుంది. ఇది ప్రకారం బెనిఫిట్స్. నా సర్జన్ కోసం ఏం బెనిఫిట్? నాది 3D విజన్ ఉంది, నాకు కరెక్ట్ చూస్తున్నారు. ఆపరేషన్ ఫీల్డ్ నాకు కరెక్ట్ గుర్తుంది, మ్యాగ్నిఫైడ్ వీల్డ్ గుర్తుంది. అది మ్యాగ్నిఫైడ్ వీల్డ్లో ఇది రిస్ట్ లైక్ ఇన్స్ట్రుమెంట్స్ ఉన్నాయి. అది ఇన్స్ట్రుమెంట్లో చాలా ప్రిసైజ్ ఆపరేషను చేసేసి విమెన్ ప్రాబ్లం కోసము, గైనకలాజికల్ ప్రాబ్లం కోసము, మేబీ ఫైబ్రాయిడ్, ఎండోమెట్రియోసిస్, క్యాన్సర్ ఉంది, ఇన్ఫర్టిలిటీ పేషెంట్స్కి ఎంతమంది సర్జరీ కావాలి అనే సర్జరీకి పేషెంట్స్కి చాలా బెనిఫిట్. నా ఈ పేషెంట్స్ ఈ ప్రకారం సర్జరీ కోసము పొద్దున వస్తున్నారు హాస్పిటల్కి ఆపరేషన్ డేలో, అండ్ సాయంత్రము లేకపోతే రేపు పొద్దున డిశ్చార్జ్ చేస్తున్నాం. తొందరగా వీ కెన్ గివ్ దెమ్ ఫుడ్, వీ కెన్ గెట్ దెమ్ బెటర్. I believe, as the president of Association of Gynaecological Robotic Surgeons, women are the nodal point of family, society, nation. Anne women kosam, any problem, we must give them the best treatment. And by using robotic technology, we can reduce open surgery for any problem that women have today. And that will give so much back to have women come back to their home, children, family, workplace, society, and give back. Thank you so much. నేను డాక్టర్ రుమా సిన్హా, రోబోటిక్ అండ్ లాప్రోస్కోపిక్ గైనకాలజీ సర్జన్, అపోలో హాస్పిటల్ హైదరాబాద్లో ఉన్నాను. నేను ఫౌండర్ ప్రెసిడెంట్ ఈ అసోసియేషన్ వాళ్ళకి. We are doing 2 days of meeting at Hotel Sheraton, Financial District, tomorrow and day after, where we have 4 international doctors who have come from different parts of the world. We have a lot of national people who are doing robotic gynecological surgery to come, discuss, deliberate and teach younger doctors how to take robotic surgery forward. రేపు మొత్తం హోల్ కంట్రీ నుంచి రేపు డాక్టర్స్ వస్తున్నారు ఇది మీటింగ్ అటెండ్ చేయడానికి. వీ హ్యావ్ సమ్ ఇంటర్నేషనల్ స్టూడెంట్స్ అండ్ ఇంటర్నేషనల్ డాక్టర్స్ ఆల్సో కమింగ్ టు అటెండ్ ద మీటింగ్ ఆల్సో. ఇఫ్ యూ కమ్ టుమారో వీ విల్ ఇంట్రడ్యూస్ దెమ్. థ్యాంక్ యూ అండి.